Hello, my name is Marvin Ward Banks and I am a mental health professional. The setting of my therapy clinic is a nice, comfortable environment for the children, which includes plenty of room and a large amount of different activities for them to keep doing. Keeping the children busy is very important because it enhances their concentration and ability to focus, trying to build skills where they lack in performance. Also, keeping them busy is very important in individuals because they can lose their concentration and focus. It will be difficult getting them back into a comfortable setting and getting them back into concentration. Children will wait in the lobby area where it is filled with different activities until they are called in for the therapy session. In my profession, I specialize in determining patients' ADHD level and recommend proper treatment to the parents for future analysis and a better future for the patient. ADHD is an attention-deficient hyperactivity disorder that affects the ability of someone's focus and how they pay attention. Many people with ADHD find it difficult focusing on some tasks and different subjects. I have been in this profession for 12 years, and over the last 5 years, I have treated patients with this specific disorder and related symptoms. 473 patients out of 989 patients. Some symptoms parents may notice in their child is cognitive and behavior symptoms, along with mood swings and sometimes depression. Some cognitive symptoms include difficulty focusing, short-term attention span, difficulty in paying attention, and their mind is completely somewhere else. Some behavioral symptoms include hyperactivity, excitability, aggression, irritability, and the repetition of words and actions. For children and young adults that have ADHD that are in grade school, I recommend that teachers keep these students in the front of the classrooms to remove all possible distractions, prescribe medications, and to control levels in brain activity. Therapy will also benefit these individuals by understanding them and understanding where they come from, and also talking to them to determine what is best for them in the outcome. In one of my previous patients, case number 1141-67, I had an 8-year-old Caucasian male who gets along with interaction pretty good, and he tends to have inappropriate behaviors often when things aren't going his way. The first thing I do is look at the patient's history, such as family history, birth history, growth and development, behaviors, social and environmental conditions, and history reports from parents and also teachers. Some recommendations that I provide for the patient was some medications, and also to help better focusing and concentration patterns. I also provided therapy sessions such as behavior therapy, cognitive therapy, patient and parent training, and also social skills training. ADHD can pretty much happen to anyone, but there are some things to help prevent it. Keeping a clear mind and keeping women healthy throughout their pregnancy can sometimes help with decreasing ADHD. Regularly visiting the doctor for checkups are very important also. Children can also face their phobias, which can result in a calmer effect on the neurons and paranoia. To other health professions, I recommend understanding the patient, make them feel comfortable, and let them know exactly what you can do to help the patient feel calm and less hyperactive. It is also very important to the patient to get all necessary information from the parents because they play a huge role in determining what is best for the child and what is the best medication and recommendations. Some major problems that still need to be solved are: what are the long-term effects? Is ADHD lifelong? And also, is there a specific cure that can help with ADHD? Some recommendations that I prefer to parents is be positive towards their children. Make sure the directions are understood when they are given directions to their children. Have discipline. Make sure your child sits in front of the school to withdraw all possible distractions. Take the time to listen to their children and be consistent. Make sure that everything that you're saying is going to happen, make sure it happens. So pretty much keep all your promises.